Hello. Thank you very much for this wonderful opportunity that you have given me to talk about planetary health, the health of our people and the planet, and what is the role of dermatology in addressing some of the most pressing challenges of our time. And let me begin by welcoming you to the era of planetary health. We now live in this age when our health is greatly shaped by the many different forces happening around us that emanate from the environment, which are, by the way, heavily influenced by our human activities, our decisions. And here you will see that there are many underlying drivers that shape the health of the planet that in turn influence the health of people. You will see that our consumption patterns, the demographic shifts that we see, like migration, urbanization, and technological advancement, all of these affect the planet's health, create a wide array of ecological damages such as pollution to the air, water, and land, biodiversity loss, climate change, and many other environmental challenges. And all of these alter the proximal social and environmental determinants of health, which then eventually affect the health of human populations. As you can see on your right, there are many different disease areas or arenas that will be affected by all of these planetary health challenges. And so I always remind my medical students that we now have to treat two kinds of patients. On one hand, you have that kid wearing a face mask, trying to protect herself from the unseen coronavirus, or perhaps from dirty air pollution in the city where she's living in. On the other hand, you also have Mother Earth also wearing a face mask, of course, not to be protected from SARS-CoV-2, but to be safeguarded from the many different ecological damages that we are inflicting on her as a result of our irresponsible human activities and decisions. And that is what planetary health is truly all about. Again, we now have two patients, not just the people, but also the planet. And the health of people and the health of the planet are inextricably intertwined and, if not, inseparable. And this idea that the health of the people and the health of the planet are deeply interconnected, that the term planetary health may sound new to many of us, but the concept, the idea of this in deep interconnection is not a novel invention. We just have to go and listen to indigenous cultures, ancient wisdom, and we will recognize that many people, many communities for centuries have been acknowledging this, interface, this deep interconnection. According to Chief Seattle, who is an indigenous leader of the Americas, the earth does not belong to man. Man belongs to earth. Man did not weave the web of life. He is merely a strand in it. Whatever he does to the web, he does to himself. So whatever we do to Mother Earth, they all come back to us in the form of human disease, despair, disability, if not death. Again, it talks about our deep interconnection. So a while ago, I showed to you a diagram that depicts the trajectory that connects our human activities, our human actions to environmental changes, all the way to human health impacts. And here I'm just zooming into one of the major planetary health challenges that we are facing today, and that is climate change. Climate change is a result of our addiction to fossil fuels, to burning of petroleum and coal and other fossil fuels, generating a lot of what we call greenhouse gas emissions that destabilize the global climate system and that lead to a long cascade of effects that eventually affect human health. And in this diagram, you will see that climate change affects human health in many different ways. There are direct effects on human health through direct exposure. For example, when our human health, our human bodies are exposed to typhoons and flooding and intense heat, which we've experienced in the Philippines and across Southeast Asia in the past several weeks, affecting our daily affairs. But we also have the indirect effects of climate change. Climate change alters the social and environmental conditions in which people live and thrive, such as the quality of water, the quality of our air, the food that we take. And all of these eventually also affect human health. And on your right, you will see that there is really no single disease group that is going to be immune to the effects of climate change. You name it, and that organ system or that arena of health will surely be affected, whether it's chronic non-communicable diseases or infectious diseases like dengue, malaria, or even new COVID-19s, new zoonotic infections. But also the state of our nutrition is expected to be reversed. There's even one study that said that around 50 years worth of global gains in nutrition are expected to be reversed if climate change is not going to be averted. And even the health of our brains and hearts. Climate change is also a mental and emotional health issue. And so, and we're experiencing more of that already in the Philippines, either through the post-traumatic stress that is generated after an intense typhoon or flooding, or through a more subtle, impact, what we call climate or eco-anxiety. In fact, there is one study that revealed that the Filipino young people are the most climate anxious in the world. So it's affecting many arenas of our physical and mental health. And it's interesting because in this diagram, what's not really mentioned explicitly is its effects on skin health, on dermatology. But I would say that, skin health is also connected with many of these different arenas. And so, as dermatologists, you also need to pay attention to these many other effects on human health, which have a dermatological component. And so, as I already highlighted, climate change is the business of every clinical specialty, of every health profession. And in this interactive website, in the New England Journal of Medicine, what you can do is you just click on the organ system, and it will tell you how that organ system is being affected by climate change. And as you can see, there's a box here for dermatologic disease. It just shows to us that every clinical specialty has an important role to play in addressing climate change and its health impacts. And so I'm actually commending your field, your clinical specialty, for organizing this session and for making sure that climate and health, that planetary health, is included in your programming. Climate change is something very familiar to us in the Philippines, especially when it comes to what I call the wet phenomena of climate change, the typhoons and the intense flooding. In the past 4 years, we even have experienced the confluence between two crises. On one hand, the climate crisis, and on the other hand, the COVID crisis. And imagine, in the coming years and decades, we will be facing more and more of this interplay between pandemics and climate related extreme weather events. And therefore, we need to really think about our preparedness, our ability to respond, and our ability to rebound. How can we make sure that we continue our society's functioning, our health systems, operations, even in the face of overlapping crises such as a pandemic and a typhoon and a flooding happening all at the same time? But also, as I already alluded to a while ago, we are beginning to experience new forms of threats, unprecedented in our modern history, such as the heat wave that is still happening in our country and in the Southeast Asia region. As you can see in this series of maps, we are expecting the Asia Pacific region to become a much more hotter part of the world. And therefore, we need to brace ourselves for all the societal impacts, the physical health impacts, the mental health impacts, and included the skin health impacts, which I will be talking about shortly. So now, because I'm talking to dermatology friends, I will be highlighting a bit about the effects of climate change on skin health. And this is an interesting table that was published in 2014. It just shows to us that many, if not all, arenas of skin health will be or is expected to be affected by climate change through its many different manifestations and hazards. And that's not surprising. The skin is the largest organ system. It's very much exposed to the elements. And therefore, whatever happens to the surrounding environment is expected to influence and to affect skin health in more ways than one. And so, for example, you will see on the first column the different phenomena or factors related to climate change. And on the second column, you will see the different skin diseases, the different skin disease groups that are expected to be influenced by the changing climate. So, for example, many of the different infections, whether they're bacterial or fungal skin infections, they are highly susceptible to changes in precipitation and in humidity. And also, our chronic skin diseases like psoriasis and atopic dermatitis are also highly influenced by humidity and temperature. The El Nino phenomenon, which is a separate phenomenon but deeply related to climate change, is also expected to alter the behavior, the patterns of many skin infections, but also infections that have dermatological components, such as dengue, as you can see there. And then waterborne diseases, which also have dermatological components, are also highly susceptible to rainfall, flooding, and increased temperature. And then when we experience more extreme weather events like typhoons and flooding, when our skin is exposed to these phenomena, to these intense weather events, we can expect more skin and soft tissue infections happening, scabies, urticaria, leishmaniasis, and at the bottom, you will see that increased exposure to extreme heat, partly due to climate change, but also partly due to changes in the ozone layer. We can anticipate an increasing incidence of skin cancers. So again, all arenas of skin health is highly susceptible to the many different pathways that link climate change to human health. This is a much more dynamic and a much more visual representation of what I just presented to you a while ago, and also much more updated. This is a diagram published in a 2023 paper showing to you that climate change or global warming is going to affect, as I mentioned a while ago, many different arenas of skin health, whether they're the malignancies or vector-borne diseases with dermatologic component. Autoinflammatory dermatosis was also highlighted here, unlike in the previous table. Contact dermatosis, skin and soft tissue infections, which I also mentioned, but also interestingly, marine dermatosis. And this is very important for a country that is archipelagic and surrounded by a lot of water. Many people dip into the waters along coastlines and low-lying islands, and therefore they are susceptible to marine dermatosis, which are in turn also influenced by many of these environmental factors. And as you will see here, that apart from global warming, as I already mentioned, increased humidity, ozone depletion, and extreme weather events. But here, it was also added that ocean acidification, the acidification or the increasing acidity of our ocean waters that is also related to climate change, and air pollution, which is still a major problem in many different cities in the Philippines. All of these also interact with global warming to affect and to worsen and exacerbate many of these skin health issues and skin disease groups, as you can see in the many different arrows that are depicted in this diagram. So I will not go into the details of each disease group. I think what is being very much highlighted here is that we need to start thinking about not just individual hazards, but the interplay of hazards and how they are expected to influence and worsen and exacerbate skin health and skin disease conditions. So, so our skin health, in short, in summary, is going to be affected, altered by the surrounding environment. And unfortunately, climate change is continuing to worsen. It's worsening as we speak. The UN climate chief said that we only have 2 years remaining to save the planet. Some scientists say that we only have until 2027 to destabilize or to stabilize the global climate system to keep the global average temperature increase to below 1.5 degrees Celsius. And so we really need to act sooner rather than later, and to really need to act fast. And every clinical specialty, every health profession has an important role to play, as I already highlighted. And this is an interesting collage of the many different emerging efforts from the dermatological community, especially in the United States. The American Academy of Dermatology established a climate change and environmental affairs expert research group. And they even have a very interesting website, climatedermatology.org. They also call themselves dermatologists for climate action. And over the past several years, there have been many papers published around the role of dermatologists. There's at the bottom the dermatologist's call to emergency action on climate change. At the top, there's an article talking about how do we reduce the environmental footprint of dermatology. And there's even one letter. At the bottom, you can see that there was a question, how can we also address the environmental impact of dermatological society conferences? So these are laudable efforts, and I hope that the Philippine dermatological community will also step up and take action and embrace climate change as your issue, as their issue, especially because our country is at the heart of the climate crisis, very much vulnerable to the impacts of climate change and its health effects, including its skin health effects. So, of course, for example, when in the context of extreme heat, which again, as I mentioned, we're still experiencing today, we really need to educate the public about sun safety. I'm sure these are all familiar interventions to you, including the use of sunscreen. But from a planetary health lens, we need to really think broader about solutions on how to heat proof our communities, our people, not only against skin diseases, but also other forms of heat-related illnesses. But just focusing on sunscreen, this is a very interesting article published in the Lancet Planetary Health. It says here that it's time to think about skin cancer and its prevention in the context of planetary health to balance the benefits to human health with the preservation of our environment. So it acknowledges that sunscreens are very important for skin protection against the harmful rays of the sun. But it also asks specifically the dermatological community to think about the potential and the actual environmental impacts of sunscreens and to find ways on how to strike a balance between skin health and the planet's health. It says here that in laboratory conditions, oxybenzone was toxic to corals and led to coral bleaching, which is also worsening an effect of climate change. And then in some Japanese fish species, exposure to high concentrations of oxybenzone led to decreased egg production. And that has huge implications in our fisheries, our ability to produce fish, which is a major important source of nutrition, especially for coastal communities, for communities relying on aquatic and marine resources for their sustenance. And so here, dermatologists are urged to really think from a planetary health lens, which, according to this article, is already very familiar to your community, given that when it comes to malignant melanoma, you are very much aware that it's due to the depletion of the stratospheric ozone. And so, those connections between the environment and health, this is something not new to you. As I already mentioned a while ago, the skin is very much influenced by many different environmental factors. So, this is something that is already part of your business for some time, and it's being just deepened now that we have acknowledged that we live in what we call the planetary health era. And as I already alluded to a while ago, we need to start looking at how our practice is impacting the environment. I will not belabor you with the details of this diagram, but as you can see, different parts of the sector, of the health sector, of the health facility contributes also to greenhouse gas emissions. And it's not only regarding our use of electricity, it's not only about the use of different kinds of materials, for example plastic, the waste that we generate, the equipment, the devices, the pharmaceuticals, and like sunscreens that I mentioned a while ago. These are all contributing different levels of environmental footprint, and therefore we also need to look within our own backyard and find ways to reduce our carbon footprint in order to contribute to mitigating climate change. And we also need to make sure that our health systems are resilient to the effects of climate change, that we are able to continue our operations, provide care to people, that we're able to bend without breaking, that we're able to recover and recover better than before rather than collapsing. And some of the measures that we need to do in order to build climate resilient health systems are as follows. And they are not specifically unique to dermatology. They can be applied to any disease arena or clinical specialty. But I think these are common principles that we should abide by in order to build health system resilience. We need to intensify disease prevention. We need to address the social environmental determinants of health and disease. We need to enhance disease surveillance for many of the climate sensitive disease conditions that I've mentioned. Strengthen our health facilities, our diagnostics, our supply chains for medicines, and many other healthcare commodities. We need to equip the health workforce, like ourselves, physicians, and other allied health professionals who are going to face all of these climate sensitive health issues. We need to improve our diagnostic capability and also be able to treat these climate sensitive conditions when they arise. And perhaps most importantly, we need to engage our communities by educating them, by having them involved in resilience building activities in our communities and in our health systems. And as I've mentioned, we need to equip our workforce. We need to embed planetary health in the education of all our health professionals, including dermatologists. And that's why, again, I laud you for including this topic in your post-grad session today. And at the heart of planetary health education is that repairing, that restoration of that broken interconnection that we have within nature. And after once that is cemented and established, I think that all things will follow. That mindset that we think in terms of systems and not silos, that we see all the interconnections, that we are able to balance human health considerations with planetary considerations as well. All of these are vital in the education of our future health professionals, but also in the re-education of our existing health workforce. And we need to remember that, yes, we need to do many things within our own sector, within our own specialty. We need to do many things within the health community, but we also need to work with the other sectors in order to improve the health of both people and the planet. And I hope to see more dermatologists being deeply engaged in cross-sectoral action, working with urban planners and the energy sector, the transport sector, the food and agricultural sector, because nutrition is also very interconnected with skin health. All of these sectors need to also do their part in order to improve the health of people while trying to stabilize our environment. And in doing so, we need to make sure we are in constant communication with all of these sectors. We are part of cross-sectoral collaborations in our country and even beyond. So I want to close my talk by highlighting that planetary health is an invitation to planetary humility. It invites us to shift away from this ego logical perspective. Oh, we human beings are at the top of the pyramid of nature. We can extract, consume, contaminate, pollute, and destroy. And instead, we need to shift towards a truly ecological perspective where we human beings live in harmony and greater solidarity with all creatures, great and small, and with all the other components of planet Earth, our one and only home. And finally, I think planetary health is about becoming a good ancestor. What we want is that by 2124, the children of 2124 will read the history books and will look back to the past, and they will say that the dermatologists of 2024 were good ancestors to them because they made the right decisions, not just for their own health and for their own patients' health, but also for the health of future generations as well. Are we ready to becoming good ancestors and not to become selfish ancestors for these children and for the future children of the Philippines and of the world who are yet to come? So together, let's advance the health of both people and the planet. Thank you very much and congratulations.